Hello po. So, our group will be reporting about the imaging techniques in equine lameness. So, what is imaging? It is diagnostic and confirmatory. In modern-day veterinary medicine, imaging is very crucial and important. Oftentimes, it is used as a diagnostic or confirmatory procedure for proper diagnosis and subsequent therapy. So, why is it important? Basically, the procedure is important in data gathering to treat a disease and condition in cases in which therapeutic drugs seems to be ineffective in a recumbent and lethargic horse. These procedures help a veterinarian explore other possibilities that lead to that disease. It is useful in data gathering, and there are other options. What is lameness? It is a manifestation of disease that is related to the musculoskeletal system. It is often characterized by abnormal stance or gait. Lameness is said to be caused by congenital problems, trauma, infection, metabolic problems, and disorders of the nervous and circulatory system. Basically, it affects the locomotion of the animal affected, and in this case, horses. It is important to clarify that lameness is not a disease, but a clinical sign. As said earlier, it may be caused by multiple factors, but the two main things that manifest in lameness are pain and mechanical restrictions. Both lead to mechanical lameness. So, what is the hallmark sign usually present? Mechanical lameness is best characterized by an upper fixation of the patella as seen on the picture. It is not easy to identify or even correct lameness since there are a lot of factors to consider. Number 1, the general condition of the animal. Is it aggressive? We do not want a vet or a personnel in the farm to get hurt during the process of physical checkup or observation. Number 2, what could be the cause? It is stated earlier that lameness can be caused by congenital problems, trauma, infection, metabolic problems, and disorders of the nervous and circulatory system. We cannot simply give antibacterial drugs since it is stated that an infection can lead to this. So, an in-depth review with history taking is needed. Third, its importance to the farm. In the Philippines, we cannot decide on our own or simply give a solution on how to treat the horse. In poorer areas of the country, it is clear that most of the time, if a horse suffers from lameness or loss of use, owners either sell or cull the horse due to poverty and, again, loss of functions, since most horses are also used in farms. In richer families, companies, they find a way to somehow save the animal. Clearly, as veterinarians, we should be aware of the condition of the owner and its farm before we give the possible solutions. And lastly, the severity of the condition, can it be saved or not? Next, is it hard to create a treatment plan for lameness? But it is also complex to diagnose one. Investigation of a lame horse may be time consuming and cause is not obvious. Personnel must be knowledgeable on equine anatomy, normal conformation and gaits, regional anesthesia and imaging techniques, and must be able to recognize forelimb and hind limb lameness. The investigation would start from a history that involves the breed, age, diet, sex, and training, etc. Then, a physical examination via manual palpation of the limbs and in weight-bearing and non-weight-bearing positions, checking for symmetry, swelling, muscle loss, abnormal stance, and obvious injuries. But still, in some cases, these procedures are not enough to confirm the diagnosis. Evaluation is needed, and the best way to do that is through imaging. Diagnostic imaging procedures are used to evaluate, diagnose, and confirm a condition or disease or abnormality, and is even used in routine checkups in some farms. The following techniques used on lameness in horses include radiographic imaging, ultrasonography, nuclear scintigraphy, magnetic resonance imaging, and infrared thermography, all of which will be discussed later. These are the steps to perform a routine or traditional lameness examination. These steps include complete history of the horse. The importance of obtaining a complete history of the horse's status cannot be overemphasized. These should include breed, age, use, performance records, circumstances of injury, duration of signs, treatments, among others. It is absolutely essential to listen carefully to the people who know the horse. Their observations and opinions of the problem as they see it form the initial thought processes for the investigation. Next are the visual examination of the horse at rest, palpation of the musculoskeletal system including hoof, tester examination of the feet, observation of the horse is in motion, usually at a straight walk and trot loop followed by circling, and the horse's status of disposition makes it potentially unsafe. Videotaping the lameness for future reference is recommended because it allows for multiple reviews and comparisons in the future. Next step is observation of the horse under saddle or in work if necessary. Manipulative tests such as flexion test, diagnostic anesthesia if needed, and diagnostic imaging. Most equine lameness or gait abnormalities are diagnosed and treated using a simple, reasonable, systematic approach. However, there is a decision-making process that must take place in examining lame horses. Lameness can involve one limb and one cause or have clinical evidence of multiple significant musculoskeletal abnormalities that may be secondary to one or more etiologies, including in some horses, infectious, metabolic, or neurological disease. Imaging options have increased in number and quality, and questions have arisen as to which of these modalities or combinations in the best application of is the best application for given situation. An imaging modality requires two learning curves before veterinarians can become proficient in its use. The first is to understand the modality and use it safely and effectively. The second learning curve, and the most difficult, is learning to accurately interpret the images. Proficiently in imaging requires knowing which modalities to use in different situations to gain the necessary information in the most efficient manner. The first technique is radiographic imaging, or what we usually call X-rays. This is the most commonly used tool to evaluate lameness, which can be used to assess joint and bone problems in affected region. There are two types of radiography being used in today's practice: the computed radiography and the plain film radiography. Plain film was once the standard procedure in terms of radiography, but eventually it was replaced by the computed radiography. Computed radiography uses a phosphor plate that is needed in storing energy from the procedure. The energy stored is then delivered to the engine, which is the computer, that produces the image. The image is seen in a computed radiography machine. Computed radiography has two types: the direct and indirect. The main difference between the two is that direct computed radiography would produce images faster, but both types would have the advantage of having few retakes, low contrast problems, and lower exposure to radiation, since the equipment for radiation is minimal. For the advantages and disadvantages, next slide. Generally, computed radiographies are used in many clinics globally since its installation and cost requirement is low. In relation to other radiographic techniques, computed radiography is mostly compatible to other existing conventional systems, making radiographic procedures possible for small-scale vet clinics. Computed radiography has multiple cassette sizes that are intended to support different phosphor plates. This leads to an increased flexibility of positioning in any area of examination. Computed radiographies can provide a rapid examination and presentation of image. The rapid image production of computed radiography is possible due to imaging plate readers that are incorporated in the system. Disadvantages: in order to have images, computed radiography requires a cassette removal from the machine. These cassettes are placed to a reader by a technician, which is required to leave the room for a period of time. Compared to other procedures, the phosphor plates used in computed radiography needs a longer time to be processed. When single plate readers are used, overexposures entail additional detail, as the old signals are not completely erased very quickly. This means that a new plate cannot be inserted before the old plate is cleared of residual signals. The delay in computed radiography plate is related on the first and second disadvantages. It takes 1 minute to process the plates. The process would be longer if the time required for cassette removal and transferring are also included. Digital radiography provides veterinarians and technicians a radiographic image. Note that an X-ray image is viewed with high definition and is delivered on screen within seconds. Identification of fractures and bone damages and deformities. Digital radiography uses an X-ray camera that captures an image and delivers it to the screen. The image can be enhanced and adjusted via the screen. It is the standard procedure done for veterinary radiology. Advantages include instant results, where fractures and catastrophic bone injuries can be seen within seconds. Consistent imaging qualities, comparing it to the film, the quality is more consistent. Image settings, such as brightness, contrast, and magnifications, are easily adjusted. This advantage leads to less stress in horse since repetition due to poor quality of image is lessened. Images can be saved and be emailed in minutes. This leads to quick evaluation and diagnosis, which also leads to faster assessment. Disadvantages. Not all digital machines have the same settings and quality. Some have no storages or cannot be emailed. These are cost per shot expense and is expensive. With price ranging from $30 to $45 or 1,500 to 2,100 pesos per shot. Radiographic imaging. There are things needed to be understood in performing radiographic imaging. First is the general preparation is a must. This would include the preparation of the area to be radiographed, cleaning the area to avoid debris disrupting the area, keeping the facility aseptic and clean to avoid future health issues. In positioning, it is required to have multiple angles for an optimal diagnosis. It should always be remembered that we must avoid mistakes while formulating diagnosis. Sedatives are required especially when the animal is aggressive or in some anatomical areas like the hips and thighs. Production of good radiograph can be attained by having the proper settings. An improper KVP and MAH setting leads to poor image quality. However, it should be considered that these factors depends on the type of machine and type of procedure being performed. The main goal we want to attain in performing diagnostic imaging is that an efficient and clear view of the affected region with enough number of radiographs for evaluation. Accomplishing this would lead to better diagnosis and this may save and help affected animal. The next technique is ultrasonography. Ultrasonography is very useful in understanding and evaluating injuries and inflammations. It can reveal the damaged fibers and fluids in soft tissues. The practice is also used as a guide whenever injections are needed or given. Ultrasound can help identify bone and joint surfaces. It is used best in evaluation of the following: inflammation of tendons, inflammation of ligament, and inflammation of other soft tissues. In comparison with radiography, ultrasounds use sound waves that travel into the animal's body. The probe shall capture echoes which are processed to create an image. Density affects the result images. It should be noted that the sound waves that are emitted from the probe have high frequency and also in terms of density, less reflective structures would appear black or darker and the reflective ones will be wider. Advantages of ultrasonography. Comparing it to the radiograph procedures, ultrasound does not require a protective gear for against radiation. It is not invasive, making the whole procedure safer. Detailed images are being displayed, however, it depends on the type of machine available. Clearly, newer designs would produce better images. Images are being processed and are able to be stored for future references. Disadvantages of ultrasonography includes operator dependent, uh, requires knowledge and expertise, training is required, and other types would produce poor images. Nuclear scintigraphy, also known as bone scan. This highlights bone metabolism, in which it allows doctors and technicians to identify areas where injured or diseased bones undergoes remodeling. The scanning is done if abnormalities are not found in X-rays or ultrasounds, but the horse has multiple weak limbs. The scan can turn up a range of conditions that involve bone inflammation. It can also identify avulsions in which damaged ligaments tear away from the bone, taking a small bone fragment with it. And it can also identify sclerosis of the bone under cartilage or bone and joint infection. The procedure requires an intravenous injection. This injection has radioisotopes that are linked to the bone tracer agent. The horse is secured to a wall and will be given tranquilizers. This is done to prevent imaging procedure. The camera used is called a gamma camera. Radioisotopes would circulate within the body and will be scanned by the gamma camera. An increase of bone remodeling is in an area would be shown due to the absorption of the radioisotopes called hotspots. The images recovered from the areas where remodeling is undergoing can show focused or diffused and mild, moderate, or intense activities. Advantages of nuclear scintigraphy. It is the only procedure that allows technicians and doctors to review and evaluate the entire skeleton of a horse. This is used to uncover problems and abnormalities that are not present in radiographs and ultrasound. It is more sensitive in identification of bone inflammation versus radiographs. This can detect early signs and stages of bone diseases. Disadvantages of nuclear scintigraphy. The procedure only shows the area of the problem or inflammation, but can't identify its cause or provide a detailed image of the problem, which leads to a requirement to use other imaging techniques to identify the cause. Note that a procedure takes $1,200 to $2,000, which is equivalent to 57 to 95,000 pesos. The magnetic resonance imaging. Magnetic resonance imaging, or MRI, is using magnetic fields. It is one of the most important diagnostic tools in equine lameness. It is the opposite of nuclear scintigraphy, which is used if more information is needed to confirm a tentative diagnosis in cases of hoof pain or problems. The magnetic field in MRI would create a cross-sectional view. The MRI is used if hoof problems are present, especially if ultrasounds show poor quality images. In cases of heel problems or pain, MRI can pinpoint the structures within the hoof that may be causing the problem, either from ligaments, navicular bone, and caudal portions or of deep digital flexor tendon and or navicular bursa. Generally, the procedure is rare locally and is expensive. Only few clinics have the machine for equines in our country, and considering its capabilities in imaging evaluation. There are two types of MRI that are used in horses: the high field and open MRI. High-field MRI would have powerful magnets and produce the most detailed images. The horse is anesthetized for lower leg placing into the machine, while open MRI allowed the horse to stand under mid-sedation during the scan. This type has C-shaped magnet that fits around the area that is needed to be scanned or imaged. Advantages of magnetic resonance imaging or MRI. This produces a detailed image in all tissue types. This has better sharpness and contrast control, and it allows early treatment for diseases because it can identify problems precisely, which may lead to better recovery. And lastly, it can diagnose disease or conditions that are not identified in other imaging procedures, such as swelling in the navicular bone. Disadvantages of MRI. The procedure and the machinery installation are expensive. Clinics that has machinery for the procedure is rare, and currently MRI only accommodates lower parts of the limb and is not good for fetlock and patellar problems. Infrared thermography. The procedure produces heat patterns on the surface of the horse. Warmer temperatures have reddish to purplish color, which are areas of concern, and cooler temperatures has bluish to black color and are less considered areas of concern. The procedure is used as a complement to other diagnostic imaging techniques. Based on the photo, we could see areas in which red and blue areas are more obvious. Red to purplish areas are warmer, which suggests an increase in blood flow to the area, which means there is a possibility of inflammation or infection. Blue to blackish areas are the opposite. Blue or colder areas, which means there is normal blood flow, meaning there is no problem with the area. Infrared thermography is a complementary procedure since it can highlight areas that may have inflammation in the foot, the joints, bones, ligaments, tendons, and muscles. It can also monitor healing through changes in colors. And lastly, it can identify areas that have increased blood flow. Temperatures are recorded and evaluated through the color patterns. The patterns are recorded by a camera that can accept infrared signals or heat. It will be a thermal image after being processed by the camera electronic processor. Infrared thermography advantages include non-invasive and since sedation are not required, and cameras used in the procedure are 10 times more sensitive to heat if compared to the sensitivity of human hand to heat. This advantage allows the machine to pick up temperature differences before more accurately, which are probably missed if done in a physical exam. Disadvantages of infrared thermography includes that there are many things that affect heat surfaces such as the room temperature, air conditioners or heaters, wet area, if the area is too dry, and outdoor weather. This also requires training and knowledge and mastery. The endpoint should result in a diagnosis or at least a short differential list of diagnosis and prognosis, at whatever level it progressed. The diagnostic information gained from the process should lead to a treatment plan. Many factors must be considered at the decision level of the diagnostic algorithm. For instance, it may be uh, impractical to perform a series of costly procedures in an older horse if the lameness has a guarded prognosis. Common sense should be intervened if the clinical findings suggest that a blind pathway has been chosen to try and solve the horse's problem. The primary goal is to efficiently define the cause of musculoskeletal abnormalities producing lameness, which can lead to the application of efficacious therapeutic measures that restore function. The sustainability of a trust client is based on providing accurate information, including the correction of misguided information that a given form of imaging will do all and tell all. These are the references that we used. Thank you for listening. Stay safe and God bless.